This is your Vaccine Quick Spot on shots. Hi, I'm Ashley Workman, the health educator and adolescent vaccine coordinator for the immunization branch of the Kentucky Department for Public Health. And I've started a new video series to give you bits of important information you can view at any time throughout your busy day. For our first video, we are going to discuss the importance of following up on school vaccinations. Immunizations aren't tied to brick and mortar learning. Children need vaccines to help boost their immune system against illnesses they can get anywhere. Just because some children are not going physically back to school now does not mean they should forego their vaccinations. You don't want children caught with a vaccine-preventable illness during a pandemic. Discussing the importance of following up on school vaccinations today will be Michelle Mallicoat, the Kentucky Department for Public Health School Health Consultant and Wild Child Assessment Coordinator.
Hello, my name is Michelle Mallicoat. Today, my program is on Researching Vaccine Records Made Easy, a guide for the Kentucky school nurse. So today, I hope after this training, you will understand the relevant KRS or the Kentucky Revised Statutes or the Kentucky Administrative Regulation regarding immunizations. That number two, that you'll understand how to utilize the Kentucky Immunization Registry. Number three, you will understand how to run immunization reports from the Kentucky Department of Education Infinite Campus data system. Number four, you will understand the process for review, be able to prioritize your follow-up, outreach, and ongoing documentation of immunizations using the following immunization reports available in IC. The first one being the no certificate report, the second one being provisional certificate report, the third one being the standard certificate report. Understanding immunization documents found in the student's cumulative health folder will also be discussed today. There are 4 Kentucky Revised Statutes and Regulations that we're going to be talking about a little bit today. The first one is KRS 158-035, and that is specifically regarding the Certificate of Immunizations. The second one is KRS 214-034, and that one is immunizations of children. The two KARs are 902 KAR 2.060, which is the most updated and current reg that we have, immunization schedules for attending, and then the 902 KAR 2.055 immunization data exchange. The first one that's real important for us to look at today is 158-035, and basically what this one says is that no child shall be eligible, and I have that highlighted there, to enroll as a student in any public or private elementary or secondary school without first presenting a certificate. So again, the child shall not be eligible to enroll without first presenting a certificate. The second one, 214-034, talks about all public and private and primary secondary schools and preschool programs shall require a current certificate for any child enrolled as a regular attendee as provided by the administrative regulation of the Cabinet of Family Services. Now here is the caveat: to be on file within 2 weeks of the child's attendance. So we have the first one that says you must have a certificate to enroll, and this one says it needs to be up to date and current within 2 weeks of attending. KAR 902 2.060 talks about the schedules for attending, and this administrative reg establishes the mandatory schedule for attendance, and it categorizes the schools in this lump. It's child daycare centers, certified family health care homes, licensed facilities which care for children, preschool programs, and here's ours, public and private primary and secondary schools. And again, it says a completed immunization certificate shall be on file for a child who is enrolled in a public or private primary or secondary school or preschool program. This next reg is very important when you're trying to get immunization records from, say, private physicians' offices or healthcare offices. This reg establishes the requirements for reporting immunization reports in schools by the Public Health Immunization Reporting Entity, which includes public and private elementary and secondary schools, and permits recording and exchange of this data. The Immunization Data Exchange is the Public Health Immunization Reporting Entity, aka the healthcare provider, may record and exchange immunization data if the person requesting the data, aka the school nurse, provides a health-related or educational service on behalf of the patient, and it is absolutely in compliance with the HIPAA reg. And this regulation is the one that I will sometimes fax to the doctor's office, who are very reluctant to give us the immunization data. Now let's talk a minute about the Kentucky Immunization Registry. What is the KYIR? The Kentucky Immunization Registry is a web-based statewide system that collects and reports immunization data across a variety of metrics. The system protects the data quality and combines the individual immunization information into a single accurate record. The KYIR can receive and send data securely to ensure privacy, confidential, and accuracy. And it also covers along the lifespan. So the data will go in for the newborns, and it will go, even if you get your flu shot, the record should drop right on in there. The Kentucky Immunization Registry is also something that the schools can access. The schools who enroll will initially be given only read access in the registry and be able to search and print certificates. Now, this access can be modified if the school indicates that they collect the parent consent update data. A parental consent is required to be able to edit the demographics or immunization data, aka if a school would like to add historical or newly administered vaccines for their students. So I know that you all have lots of time to be able to add records, and I'm saying that as in a joking fashion. But if you would like to do that, then the registry can give you the rights to do that. They also wanted me to remind you that due to the high volume of enrollment forms, there is a 7 to 10 day turnaround time for a new clinic or school to enroll. The enrollment forms are the next slide, and the schools that want to access the registry should complete the enrollment forms below and fax them to the Kentucky Immunization Branch. And these are the enrollment forms. Make sure you have the current ones. If you have them in a file, you need to make sure that you update them with this current forms. The first one is the school enrollment form. The second one is the user confidentiality agreement, and you'll have to have one of those submitted for each nurse, and then the user account form. The KYIR has lots of great training materials. The training materials include videos and quick guides, and they're located in the reports training module in the registry. So here I have the links for those, especially how to log on and how to print, and they are available that show how to log in and also how to print the certificate. And the contact information is next. They're very, very sensitive to emails when you call. Most of the times the calls are because you have forgotten your password. So make sure that you do keep a track of what your password is, but they are very eager to help, and they will get back with you very promptly. So let's talk now about how to run an IC immunization report. I will try and slow down here a bit so that if you are trying to click along, you can do that. So we're going to go to the Health Index on the left-hand side of Infinite Campus screen. Then we're going to click Reports, and then we're going to go to Immunization Certificate. Check the box for No Certificate, Standard, and Provisional. The medical and religious are also an option to click. Generally, I run the No Certificate report first on a separate report, and this is the one we work with first because we want to get the children's certificates there whether they are current or not. Click Generate Report and then Print. The next thing you need to do, and the next slide I'm going to show you, will be a visual scan of one of these reports, but let's just look at this for a minute. Do a visual scan on the report that you have just generated and check to be sure the dates look correct. In other words, if the child has a standard certificate and they are age 11 and that certificate should be provisional, then you're going to know that that's not correct. If the expiration date of the certificate is when the child is age 8 and you know it should have expired when the child was 5, then you're going to know that that is not correct. So make sure you do a visual scan of the report. The no certificate will be blank all the way across the report. The provisional should be expired or expiring soon within 1 year, and the standard should be expiring either as the child is 4 years old, the 4th, 11th, or the 16th birthday. IC was developed based on guidelines published by the Academy of Pediatrics. Kentucky has more restrictive guidelines, so some of the immunizations may not be required on a different schedule. Kentucky schools must follow the Kentucky laws. Now, this next slide that I'm showing you is an actual IC report. I do want you to see there across the line where we have expiration dates, the certificate dates, and then the certificate type. All of the expiration dates for the child that, say, would be in kindergarten should be around the same time, and they should all be expiring around the same time. The certificate date is the date that you do enter the data into the system, and then, of course, the provisional is the certificate type. Now, on the no certificate, the first thing you want to do is check the registry. If you find the record, you may want to make a note of the vendor PIN, which is the provider, so that you can call the provider to request any missing other pieces. In other words, you could call the provider and ask for the physical form if you know when they went in for their immunizations. But that's another video. Check the cumulative health record for the certificate. Now, when I check the cumulative health record, I always look through the whole folder because sometimes the immunization records can be stapled to other documents. If the parent turns in documents, it may be stapled to the certificate to photograph or the permission for to use the computer. So make sure that you look at all of the documents that may actually be stapled together. Also check the cumulative folder for the physical exam and record the date and where the child got that exam, because you know that a child generally will be immunized when they go for their physical. You could call the doctor's office and you could request that information. So if the immunization is missing, immunization certificate is missing, but you have proof that the child did go for the physical, you can assume that the child did have shots at that time also. When we call the provider to request the certificate, this is kind of the script that I generally will use. Hi, this is Nurse Malacote. I'm seeing Johnny, who came to our office today, and I see where he came to your office for a physical. I'm also sure that they received your immunizations on that date, but we do not have the record. Could you please fax the record to us, and we would appreciate that. And that's kind of how the script might go. Now, on the provisional certificates, absolutely check the registry. Look for any missing immunization dates and print a new certificate from the registry if one is available. Check the cumulative health record for the provisional certificates. Double check to be sure that they're not stapled to other documents, and look at all the previous records that may be in that file. Sometimes we get 4 or 6 or 8 or even 10 immunization records in there, but they all should be looked at to be sure that you're not missing any dates on there. Add the missing dates for vaccines administration to the Infinite Campus. If the certificate is now compliant, you would want to change the certificate expiration dates in IC to reflect an expiration date 2 weeks after the 11th birthday or on the 17th birthday. And of course, we want to be sure that we're documenting in the contact log all of this outreach. And under the contact log, under the contact, we can type in the KYIR. You could type in the specific provider's office, or you could leave it blank if you're recording the health folder was checked. Now, the documentation on this contact log would be like, for instance, no new records found. You could put on there that you checked the health folder, that you contacted the provider, or also if you sent a deficiency letter to the to the parent. If you do send a deficiency letter to the parent, make sure that you document on there whether you sent it in the mail or if the student carried it home in their backpack. The next thing I'm going to talk about is an ad hoc letter that we added to IC at our local level, and this is the instructions that I received from the KDE on how to maybe go about doing that. The campus community does provide written instructions and videos that you can access to make your own letter, and this is an explanation on how to do that. There is also a link here that you can try. Search the letter builder for non-compliant immunization status. Every district user has access to Campus Community with their Infinite Campus access. Campus Community includes forums, tutorials, videos, and simulations that explain all aspects of Infinite Campus. It includes guidance on how to create letters and ad hocs that can be used with those letters. Because each district creates their own processes for collecting this information, the KDE does not have a standard letter that you can access. I have given the district support, Samantha Engstrom's email here that you may contact if you have questions, or you can just contact your district level IC contact and they can help you out with this. So now we'll talk a little bit about the deficiency letter that we did generate at the Madison County School District. And here's what we did. We developed the deficiency letter. We printed the deficiency letter from IC, and there was a tab there. We just clicked the letter. So under Index General on the left-hand column, click the ad hoc letter if applicable, and it has a specific notice on the overhead tab. Click the immunization letter, print, change to custom because the print will also print a second page, and fill out the specific requirements that are missing. Chart in the contact log that the deficiency letter was sent. Now we also have a hard copy that I would be glad to send out of this same letter where basically when you print it from IC, it will put the guardian's name on there and the child's name on there. Those are the only two things that it does put on there. So if it's too much trouble or you can't figure out exactly how to do the letter, or there's a delay in time from requesting that the letter be developed until you have to send the deficiency letters, you can send the standard letter and just write the child's name on it and put the date on there. So here we're going to end the presentation with this logo from the Kentucky School Nurse Association, where it reminds us that school nurses' main job is to keep kids healthy and safe. I'd like to give a special thank you to Nicole Hobbs, who is one of the nurses from the Madison County School District, who inserted input on the immunization processes for this presentation. And I want to say good luck, and that I do know that outreach for immunizations can be a difficult thing to do. We have lots of records and lots of people that we communicate with, but it is our job to keep kids healthy, and this is the one way that we can do that. Good luck on your immunization surveys, and I'll see you next time.
Hello, my name is Sarah Weibel, and I am the coordinator of the Kentucky Immunization Registry, better known as KYIR. First, I would like to say thank you to all of the wonderful school nurses throughout Kentucky. The Immunization Branch and KYIR team are incredibly thankful for your years of partnership. I would also like to take the time to thank Michelle Malacote for providing education and being an incredible advocate of KYIR. The registry is a powerful public health tool that helps ensure every member of the Commonwealth are up to date on their ACIP recommended vaccines and are protected against vaccine-preventable diseases. KYIR offers functionality to support mass events, reminders for individuals who are coming due or overdue for vaccines, and a consolidated immunization record ensuring that all vaccination histories are recorded for an individual into one concise record. Most importantly, KYIR is free and easily accessible through a web browser interface to all vaccinating providers and public health stakeholders across Kentucky. If you would like to enroll or would like further education of KYIR, please reach out to our help desk at 502-564-0038. We thank you again for your dedication in protecting Kentuckians. Thanks and stay healthy.